Good morning, everybody, and welcome in. It's time for Medica Pharmacy to bring you For Your Health. Again, this show here on WBRT Radio and on BRTV Cable. And Allison Schwartz is joining us this morning here on a sunny yet very cold morning. And does flu and cold season continue on as long as it stays cold like this, or does it really doesn't care what temperature?
It doesn't care what the temperature. Like, I know I'm tired of the cold weather. I walked up here and I thought, okay, it is March, 21st or 22nd? Mm-hmm. I don't even know what date it is, but I know it shouldn't be this cold. But yeah, no, we're still filling prescriptions for flu. There's still some Tamiflu prescriptions, not as many. And of course, the liquid is unavailable, so we're having to compound. So I think we're the only place in town that compounds it that I know of. So, which is actually interesting is that when we compound it, we put it in a special suspension that kind of enhances the flavor of it, because Tamiflu is a little bit bitter. So we put some stuff that masks that bitterness. But the great thing is you can kind of choose any flavor you want. So instead of having to go with the manufacturer flavor, the flavors when we make it from scratch actually taste a lot better. So if you're unfortunate enough to have a child that gets the flu and you need to get it compounded, the one bonus is that it will taste better.
Okay.
So you got that going. Got that going for you, you know.
Right. But don't take more than your dosage.
That's right.
It may taste good, but you know.
Yeah, it might. I don't know if it tastes that good, but I definitely know it tastes better than the commercially available stuff. So.
Pushback. National Poison. I'm looking at your notes. Mm-hmm. Poison Prevention Week.
That's
and
right.
Man, I tell you what, that's a scary thing to think of a child or even our pet or us getting poisoned by things that we're, because of not having the knowledge. So take off and tell us about poison prevention.
Right. Well, everybody thinks of poison as all of your, a lot of people have very toxic household cleaners, and then there's a big push to move to the greener cleaners. I know that I specifically have moved to where all of my cleaners in my house are non-toxic, so if you were to ingest them, really nothing bad's going to happen to you. But the one thing about poison is people don't often think of their prescription medications as being poison. Okay, but they are, and a lot of kids get those medicines that shouldn't, and it's reported that children get their hands on medicines they shouldn't over 500,000 times a year. That's a lot. That's a lot of times. Yeah. So the Poison Control Center reports that every minute they get a phone call about a medicine poisoning for a child under the age of 5. So that in itself is, golly, there's 60, minutes in an hour. That's a lot of minutes a day that they get phone calls. Every 8 minutes, there is a child admitted to the emergency room for medication poisoning. So that's a 30% increase over the numbers that we experienced a decade ago. And that's because there's a lot more people taking medicines out there. 1 in 8 Americans takes a medicine of some sort every day. And unfortunately, the average Kentuckian takes 19 prescriptions a year. We talked about that on our last show. So, that's a lot of opportunities for children to get their hands on medicines. 86% of emergency room medication poisonings were for children that took a medicine that belonged to an adult. And so not even overdosing on their own children's medicine that you maybe gave them too much, which is why so many cough and cold medicines anymore say do not give to children under 6, because it is so easy to give a small child too much medicine that can cause you some just detrimental problems and unfortunately at times death. So that's why those recommendations were changed. But that's 86% of those cases are children taking adult medicines. 43% of the time, that medicine belonged to a relative like an aunt, uncle, or grandparent. 31% of the time, it was the mother's medication. So, you got to wonder, most pill bottlers are child safe. I mean, there are people that request easy open tops, but, most people with kids in their house get those child-proof tops. So then you think, well, if you're in a child-proof container, how do those kids get those medicines, right? Mm-hmm. Well, I mean, a lot of people put them in pill boxes.
Exactly. That's what I was going to say. With date, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and sometimes morning and evening. Yeah.
Yeah. So you put your medicine to a pill box. Some people put them in a bag, which they're not labeled. So technically, legally, you're not supposed to put medicine in anything that's not labeled. So really, even pill boxes are not legal. If you're going to be out of your house, you had that in your car and you got pulled over, that is not legal for you to have that medication in that unlabeled container. Now, coming soon at Medica Pharmacy, we're going to have an answer for that. We're getting a new robotics machine. I'm pretty sure that we're getting this machine. The lady's stopping by today to go over it with us. But this machine will actually package all of your medicines in a little packaged. Now, the one thing is they're not child safe. Okay, so you're going to have to keep them out of the reach of kids, but they'll be labeled 8 a.m., noon, 6 p.m., whatever, and they come in a big box. I mean, well, it's not a big box. I guess it's smaller than a cereal box. Okay, but anyway, it's a little box, and so that'll hold all of your little rows. So you'll just pull out, your little thing of medicine, and if maybe you've been gone for the weekend, then you just pull out a few rows, and that thing is labeled. So it has your name, has all the names of the medicines. It's completely legal. But that way, you're walking around at 1 o'clock, and you're supposed to take something at noon. If your noon medicine's there, it's there, and it's a little easier. We already do packaged medications, right. But this is going to be a little easier to, rip off a couple days worth and take with you. So we're looking forward to that to make it more convenient for people to remember to take their medicines. So that being said, that one is not child safe either. So 67% of the time that these children got medication in their system, it was in places like purses, which accounts for 20% of the time, on a countertop, in a nightstand, or in a dresser, which is another 20% of the time. And other times it was in a bag, in a cabinet, in a drawer, on the floor, or under a couch cushion. So, a lot of times you drop a medicine and you think, oh, I dropped it, I can't find it, and you don't worry about it. Well, if you have a kid in the house, or a dog in the house, or a cat in the house, you need to worry about it, and you need to try to find that medicine. If you think it went under a crevice, pull out your broom, get your vacuum cleaner. I mean, something to get that pill out of the way.
Because medication is many times based on the weight.
It is.
What your dosage is, and obviously a 30-pound child versus a 150-pound person, the dosage would be significantly different. I don't know whether it'd be 1/5, but the ratio is in weight, but it would be significantly different.
Oh, exactly. Well, and I mean, you may have a child that's on a medication, and so it may not even be that medication alone would have done damage, but maybe in combination with something that child was taking could cause issues. So when I mentioned it being on the floor or being lost, that happens 27% of the time that a kid has an overdose. It was a lost or on the floor medication. So it's just something to be very, very careful with. Make sure when you're, putting pills in your hands out of those bottles that you don't drop one. So really pay attention to how you handle those medications, but keep them out of the reach of kids. A drawer is not a good place. And in a cabinet, if you have a stool they can climb up there, may not work. So, I'm not sure that, I don't necessarily have the answer, because everybody's house is different, and your house, and how kids have access to it. But it doesn't take any time at all to turn your back and have a kid have a pill down their throat, and you can't do anything about it. And strangely enough, the number one medication that children get a hold of and get into their system is ibuprofen. I mean, everybody has ibuprofen in their house, so that was the number one thing. So since we brought up ibuprofen, I thought we might mention Tylenol. Tylenol is considered to be one of the safest medications out there. A few years ago, I don't know if many people out there remember, there was, ephedra on the market, and it was, in a lot of, little mini thins that people would take when they were driving and needed to stay awake, and it had ephedra in it. Well, it was pulled off the market by the FDA because it was considered unsafe because it caused heart attacks. Well, more people die every year from Tylenol overdose than ever thought about dying from ephedra. Okay, technically it's safe in the right doses. So because there were so many Tylenol overdoses, I think a couple of years ago, just in California, there was 8,000 potential cases of Tylenol overdose, and like 4,400 of them ended up in hospitalizations and adverse reactions. So that's a little over 50% of the time. That seems a little high to me. So I thought we might touch on Tylenol because it's in everything. Yeah. I mean, you have Tylenol, and then you have, cough and cold medications, and then you have sleep aids that have Tylenol products in them. And then there's a lot of prescription pain medicines for, regular pain. There's headache-only pain medicines. A lot of these things have Tylenol. The other word you're going to look for is acetaminophen, or on that prescription label it might say APAP, which is short for acetaminophen.
That is the chemical in Tylenol? Or
Yeah.
I say the chemical, but the product.
Right, yeah. Tylenol is the brand name. The generic chemical name is acetaminophen.
Okay.
So any abbreviation of acetaminophen or APAP is what you're looking for.
Okay.
But they changed the recommendation a couple years ago to where you should never take more than 325 milligrams at a time. Now, that's the old formula. In the recent years, there's been Tylenol Extra Strength, which is 500 milligrams, and then the Tylenol 8 Hour and the Tylenol Arthritis, which is 650 milligrams per pill.
Does it have a time release capability built into those pills?
The 8 Hour and the Arthritis are technically an extended release, but they are a big dose.
Big dose. Yeah.
Now, when you're looking at prescription pain medicines, the vast majority of them always came with 500 milligrams of Tylenol. And there are some 650s and 750 milligrams in there. A lot of the companies have reformulated their products to only have 325. Now, most of them, a lot of the ones that we are still dispensing are still the old formula with 500 milligrams in it. So you have to think, if you're taking a prescription pain medicine, and some of these people have, pain medicine, but occasionally they get a migraine, so then they have a migraine medicine. Well, you're getting double doses of Tylenol. And then if you go out and you take some sleep aid that has Tylenol on top of it, or you go out and you have a few beers at night, this is a problem. And the reason alcohol is a problem is there's a product in your system called glutathione, and not that anybody really cares that it's called glutathione, but glutathione is what your body uses to break down Tylenol. Well, it's also what your liver uses to break down alcohol. So you go out for a night of a few beers or margaritas or glasses of wine, whatever it is, you use up all that glutathione to burn up your alcohol. And then you maybe have a hangover the next day and you think, I'm going to take Tylenol for my headache. Well, there's nothing left in your liver to metabolize that Tylenol, and you can overdose and you can cause liver damage. And the interesting thing is once you go through all the body's ability in the liver to metabolize Tylenol, it can then cause kidney damage, and it can actually cause asthma or worsening of asthma symptoms, because that glutathione helps prevent asthma. It also helps to line the intestinal tract. So you've got to be really careful when it comes to Tylenol. Look at your labels.
What's an alternative if that scares somebody enough to say, well, I'm just going to stay away from acetaminophen, if I pronounced it right, aspirin, and can you take too many aspirin?
Oh, absolutely. Aspirin and all the anti-inflammatories like ibuprofen or naproxen, which you see in the over-the-counter Aleve, they're all options. They all have their own set of risks. So those drugs tend to irritate the stomach lining a little bit more. They're really hard on the stomach. So that in combination with alcohol can cause little minute bleeds in your stomach. It's not as common as liver toxicity. And those also can decrease blood flow to the kidneys and cause you to have acute kidney problems. So, everything you have to be using is, you got to be careful. I mean, every drug you put in your system is toxic to you in some way, shape, or fashion. There is no totally safe drug over the counter or prescription wise. Your safest bet of anything is always a homeopathic product. So we always joke that homeopathic products, they are great and they can do wonders. Maybe they're not the right thing, and maybe they won't do a thing for you, but they won't hurt you. So, if it's muscle pain stuff, you can take arnica. That's something we use a lot. Muscle bruising, trauma, you haven't worked out in 3 months and you decide you're going to go for a jog. Take some arnica before you run, take some arnica after you run. It greatly decreases your soreness. Tylenol wouldn't have helped you anyway because it does not have anti-inflammatory actions. Okay. So for muscle soreness and pain, you would want an anti-inflammatory like ibuprofen or Aleve. But Tylenol is more for, joint pain, osteoarthritis, your common headache. That's kind of what you would use it for. But you do need to be careful with all the products that have Tylenol in them.
As you were talking, I was sitting there thinking about that, a lot of times a medical professional will ask you, what are you taking? And the first thing that comes to your mind is from a prescription standpoint. But all these things you've talked about are non-prescription, over-the-counter, buy them at any place just about. So should we always disclose, okay, I take a baby aspirin every morning or every night for my, potential health, and those are lower dosage, or I tend to take Tylenol on almost a regular basis. Should you disclose that to them?
Oh, absolutely.
Okay.
Absolutely. And that goes with anything. Maybe you sometimes take a chlorpheniramine or a diphenhydramine, which is Benadryl for your allergies. Okay. Or maybe you take Sudafed only certain times of the year. So anytime you're talking about medicines with your doctor and with your pharmacy, because, with the, people go to different pharmacies, people use mail order, people go to different doctors. So, if you come in to our pharmacy, and we even have a spot on our information sheet that a lot of people, they're like, do I really need to fill this out? Yes, you do, because I can't tell you if this medicine is truly safe if I don't know everything else you're taking. And we're mostly talking about kids, but there's plenty of people that end up in hospitals with medication problems. And, one of the number one things with people is that they take a medicine that they didn't bother to tell anybody they were on, medicine A. Well, medicine B is a big drug interaction, and there was, a big release last year and again about a week ago about one of our most commonly used antibiotics causing fatal heart arrhythmias. And, people go to the doctor, they get an antibiotic. They don't think about the fact that maybe they're on a heart medicine or they have a slightly irregular heartbeat from time to time. Well, we have two big medicines that have been linked to major heart attacks. And, it's probably the number one antibiotic that we use, and we counsel people about it. And it's kind of, your doctor thinks you need to take it and you want to take it. But, now that we're starting to see people dying from heart attacks from it, is your sinus infection really worth that? Mm-hmm. Is there a better way to do it? So it's really important to not only disclose medicines, but maybe disclose some medical conditions that you may have as well. Okay. Because, there are lots of blood pressure medicines that don't work as well in elderly. And so, we can pretty much tell if you're elderly because it's an age issue. But, there's lots and lots of medicines that if your kidney function isn't as good as it should be, that you should be on a lower dose. And so that's something that your doctor should know, and hopefully they do know, but it's something that it's always a good idea to have the pharmacy double check for you. Yeah.
Because the kidney is going to help take, with a lower dose, won't have to work as hard or won't be able to work as well.
Right. Well, and there's a couple of antibiotics that if your kidneys are really bad, instead of dosing it every day, you dose it every other day. Mm-hmm. So sometimes you go from twice a day to once a day, but every now and then you take half the dose or you skip a day in between doses because if it clears mostly through the kidneys and your kidneys only clear 50%, then you maybe only need to take it every other day. And that way it'll work just as well for you, but without causing you to be toxic. Your liver and your kidneys are the two things that clear out things out of your body. So you have to make sure that you're not overworking them. And the liver is, if you were to really look at the things that go through the liver and the processes it has to go through to detoxify things, mm-hmm. It's pretty amazing. Like if you really think about how many steps and processes and all the stuff it has to go through, you think, well, that's pretty spectacular. That guy that designed that, he was pretty darn intelligent.
He was.
It's pretty neat. But we mess with it. We test it. We have a great, amazing way to detoxify our bodies, but we've gotten to where we push it so much that it's getting harder for us to detoxify the things we need to detoxify.
When you talked about kidneys and liver functions and so forth, I just imagine anybody that's on dialysis, whether it's a one time a day or one time a week